this is Dr. J. Hartley in St. Augustine, Florida. Welcome to our health and wellness talk. And tonight we're going to be focused on neck pain, trap pain, shoulder pain, and leg pain. A little bit about myself. I went to the Palmer College of Chiropractic in 1992. And then I became a diplomat in the American Chiropractic Neurology Association in 1995. In 2011, I became a fellow of the Palmer Academy of Chiropractic. 2015, I started focusing on scoliosis after one of my daughters had progressive scoliosis. And then through the clear treatment, myself and my daughter were able to be helped significantly. And then I became intensive care certified. That means you demonstrate on x-ray correction of a curve greater than 30 degrees with a 30% improvement. And then you do that on a certain number of cases. And then you're allowed to see what's called intensive care patients, where patients come from other states and countries. They stay in St. Augustine for 2 weeks. They do 2-hour, twice-a-day sessions in our office. And then after they get corrected here, they go home and keep up with their exercises. We stay in touch with them, but from a distance, and they keep the correction going on their own. And then in 2017, I became a Scoliobrace provider, and that's a specialized 3D scoliosis brace that really works well with complicated scoliosis cases in adolescents, but also adults, because many adults have degenerative scoliosis that they don't know about. That helps with a lot. So the first thing we're going to talk about is what do you think the USA is ranked today in overall health? Any guesses?
Not very high.
Okay. There's about 200 countries in the world. We rank 37th. Would you agree we should be a lot higher than that?
I mean, with how much fast food we eat? No.
Well, right. But we have the
With
ability.
how smart we are.
We have the ability to do a lot better.
Yeah.
But you're right. With all the junk food we eat, it's not surprising how low we score. What do you think we rank in the world in infant mortality?
I don't know.
52nd. So many people think, how could that be? Because we have so much technology, so much advanced medicine, why would it be so low? Well, birth is already something that's perfect. If you overcomplicate it, then it becomes less successful.
Right.
And we do that in this country. There's many places in the United States where the cesarean rate is over 60%. And the Florida Health Department just published a stat. I think there's no reason for cesarean rate to be over like 25%. And so, you know, every region in the state of Florida is targeting on keeping it below that.
Wow.
So it's a lot of unnecessary medical procedures.
Yeah.
Over 1 million mothers, daughters, fathers, and sons will die from heart disease and cancer this year. Would you agree we need to make some major changes in the way we approach our health? Yes.
Yes.
We can do a lot of things to make ourselves healthy. So there's 5 attitudes that prevent us from being healthy. 1, it's out of my control. 2, it's normal to get sick. 3, disease makes us sick. 4, only see the doctor when you're sick. 5, it's expensive to be healthy. These 5 attitudes prevent us from being healthy. First one is health is out of my control, and genetics are responsible for less than 1% of all diseases. So we can't blame it on our parents. Health is simply the result of having healthy habits. The things we do every day determine our health. Are drugs the answer to humanity's problems? Well, the United States consumes more drugs, by person than any country in the world. And we're spending more money than any country in the world on drugs. Yet, we rank 37th. That might be our phone.
Yeah.
And so those drugs are not necessarily making us a healthier country, okay?
Right.
Because if we're consuming all those drugs, we should be the healthiest country in the world. Prevention versus crisis. If we bought a new car, drove it as hard as we could, never did any maintenance, never did any oil changes, eventually that car is going to blow up. If it blows up in front of a new car dealership, we can walk out of the blown up one, get in the new one, and just drive off, right? But we can't do that with our bodies, right? We've got to practice prevention. What are symptoms? Symptoms are merely the result of the body being out of balance and alerting you within a problem within. Symptoms serve as a warning that something needs to be explored and changed in one's life. Illness is a message. Dennis Jaffe, PhD. So if you have pain in the shoulder, right, and you just get an injection in the shoulder, you didn't get to the cause of the problem. If you have pain in your foot and you take a medication to block the pain, it doesn't mean you got to the cause of the problem, okay? So we're going to talk about that tonight. Second attitude is it's normal to get sick. That's a false attitude. It's not normal to get sick. It's normal to be healthy. Now we're going to talk a little bit about symptoms, meaning you may have some symptoms or you may have a healing crisis, but it doesn't necessarily mean your body is sick. So we're going to talk about that. And then is it the seed or the soil? Well, the seed is like your genetic potential. Everybody has a certain amount of genetic potential, but that doesn't mean you're going to be successful. And then you have the soil. That is your environment, what you're surrounded with, the food you eat, the people you're around. That determines whether you're going to be successful or not. Third attitude, disease makes us sick. Disease is lack of harmony inside the body. So Hippocrates talked about ease is health, and disease with a hyphen is loss of health. So when you're healthy and everything's in balance and working good, it's ease. With the dash dis, it means you're getting away from ease. You're starting to get toward the body not working right. And then when you get disease without the hyphen, then that's the full-blown disease, okay? Lack of harmony inside the body is disease. We spend billions of dollars studying disease and virtually nothing on health. So what we're getting is what we're focusing on. How life begins. 2 weeks after fertilization, the primitive streak is created. This will become the central nervous system, the master system, controlling every other cell, tissue, organ in the body. So we have the spinal cord here. Everything in the body grows off of that. And then here's the fetus, and this is the fetal curve, and this is the amniotic fluid. Now that position helps to protect the baby. So if the mother falls or something like that, the baby, that curve works like a spring, and then it has all the fluid in there, so the baby's very protected. Now with scoliosis, you want to preserve this fetal curve when the baby's born. So there's a book called Birth Without Violence by a French OBGYN named Frederick Labouré, and he talks about you don't want to just lay a baby flat on his back right after he's born, because you're going to lose this curve. And it's also going to be painful because the baby's been in this fetal position for 9 months. So you want to keep them in a fetal position. So we like those slings that you see babies get carried around in. You don't want to put them in the front pack right away. Johnny jumpers, saucers, those things. It's loading the spine up too soon. And then at 3 to 6 months, the baby's going to lift their head up, do tummy time, and they're going to start to bring that cervical curve in the neck, right? And so if you don't have a good curve in your neck, either it didn't develop with enough tummy time after you were born, or you had some kind of accident or habit that caused you to lose that curve in your neck, okay? And then at 6 to 12 months, when you're crawling, you develop the lumbar curve. And then you end up with these 3 curves, and your whole spine works like a spring to make it strong, okay? And it helps to protect the nervous system and keep it healthy. Defense against germs. There's no magic bullet, instant gratification, or miracle cure against viruses or bacteria. There's only increased internal resistance from hard work, nutrition, exercise, rest, and positive mental attitude. The central nervous system controls the other 5 systems in the human body: glandular, elimination, digestive, musculoskeletal, circulatory system. So we're going to talk in a minute about how 90% of the nerves control all the bodily organs and functions. Only 10% have to do with pain. Gray's Anatomy states the central nervous system controls and coordinates every cell, tissue, and organ in the body. Your body's 98% new every year. So you still have to get your hair cut, you get your fingernails cut, or you buff them to keep them short, right? So your body's putting out new cells, right? And so what we want those cells to be the healthiest ones possible. And so when we look at pain, pain is the end result of something not working right, right? So we're getting to the root of the problem. It's like you have a tree with fruit on it, and then you have the roots under the ground.
Yeah.
So when we're working on the roots of your nervous system, the nerve roots, the spinal cord, that's the foundation of everything growing and regenerating. So we want you to be regenerating and not degenerating. Guidance physiology states the autonomic nervous system is the controlling mechanism of homeostasis. So homeostasis is another word we interchange that with health, is your body's ability to adapt to the environment. That's what health is. So if you have a fever, is that good or bad?
It's bad.
Well, if you have an infection and your body raises the temperature to kill the infection, that's good, right?
Yeah.
If you ate a bad oyster and then started throwing up, is that good or bad?
That's good.
It's good, same thing, because your body's getting rid of it, right? So we want those mechanisms to work as good as possible. Subluxation. So subluxation is a bone out of place interfering with the nerve. And the word silent decay is there is because, like we said, only 10% of the nerves have to do with pain. So you can have a lot of degeneration without feeling pain. So when you all of a sudden feel pain in your shoulder, your trap, your foot, that is not when the problem started. So many people associate, what did I do, right? But usually there's an underlying cause that's going on for a long amount of time, and then you do something like the straw that broke the camel's back, and you start feeling the pain. But that's not what usually caused the problem. Your body is like a garden with proper raw materials and no interference. You will regenerate and be healthy. Healing takes time. So the hose is like the spinal cord, the sprinkler is like the nerves, the roses are like the organs. If you have a rock on the hose, then that nerve flow can't get out to the organs, or the water cannot get to the roses. If you take the rock off the hose, then the body is allowed to regenerate and to heal. Subluxations distort the structure of the spine, reducing and eliminating curves. So we talked about your body from the side has these normal curves, and they give your body strength. So in engineering, this curve is allowing this bridge to stay up. If that curve wasn't there, the bridge would collapse. Same thing with your spine. If you don't have those normal curves, then it's going to collapse and your health is going to collapse. Subluxation equals degeneration. They did a famous study called the Windsor autopsies on 1,000 cadavers, and they noticed that everybody had some pinched nerves. The pinched nerves were worse where there was more degeneration. Wherever that nerve goes, then that organ is not going to work as well. It's going to have degeneration, illness there, okay? So wherever those pinched nerves are, we want to do adjustments, allowing the body to regenerate and heal. Why do you go to a chiropractor? To get adjusted, correcting and preventing subluxations. Do you remember what subluxations are? That's the bone out of place interfering with the nerve.
The silent
Decay. Yes, right? These might be on the quiz. Degenerating spine. This patient had neck pain, shoulder pain, mid-back pain, low back pain, numbness and tingling down the left arm, depression, migraines, high blood pressure, anxiety, insomnia, tinnitus, and acid reflux. Work had become difficult. They no longer could walk or hike due to pain. Their rate quality of life is 3 out of 10. They're on pain medication every day and blood pressure medication. They recently had their first chiropractic adjustment and they're age 52. So with this patient, the head is very far forward, okay? So the head's forward from where it should be. They've got a lost curve, which has resulted in disc degeneration, bone spurs interfering with the nerve opening, stretching the spinal cord, stretching the nerves, okay? So when you look at the symptoms they're having, headaches, neck pain, shoulder pain, this is going to come from that pressure in the spinal cord, Okay. This is a healthy spine. You can see the head's half as far forward. They've got the proper curve in the neck, proper disc spacing, no bone spurs, spinal cord's relaxed. They have no symptoms, work pain-free, exercise pain-free, rate quality of life is 10 out of 10, no medications. They went through corrective chiropractic care at age 26 and have had at least a monthly maintenance adjustment every month since then, and they're 55. So they're 3 years older than the previous patient, yet their spine's healthy. Why is that? The alignment. So people in this age group always ask, isn't it normal to have this degeneration at this age? No. If you're out of alignment and your posture's bad, it's normal, but it's not normal. It might be average, but it's not normal. So wherever you are, you want to work toward the healthy spine. This patient came in with severe migraines, but this configuration could also cause a lot of neck pain, shoulder pain, okay? So her head was very far forward. The skull and the first cervical are supposed to be parallel. These were compressing. Complete reversal of the curve. Spinal cord stretched, nerve roots are stretched. She'd been to a medical neurologist, CAT scans, MRIs. The only thing they had to offer her was migraine medication. She was out of school, and even though she was taking the migraine medication, she was still having migraines. She came into our office, and this is after 2 months of corrective care. You can see the head is not as far forward. C1 and occiput C1 are now parallel. She's got the proper curve in the neck. Spinal cord is relaxed. She was able to return to school and off all medication. If she never came into our office, she would have just been known as the migraine patient and would have continued and probably would have had a lot of side effects from the medication as well. This patient, we discovered she had scoliosis at 9 years old. She had a 22-degree curve. It reduced down to 16 degrees and then 10 degrees. And the thing that I really like about this case is the relationship with the neck and her scoliosis. So you can see when the upper neck was out of alignment, the scoliosis was 22 degrees. When it got better, it went down to 16, and then when it was right on, it went down to 10. And so it shows the direct relationship between the upper cervical alignment and the scoliosis. And it's very important. And so many people have neck injuries, birth trauma, car accidents that mess up the upper neck alignment, and then they develop something else lower down. So you could have neck pain, shoulder pain, foot pain, all caused from this upper cervical misalignment. This is an older patient, went through corrective care for scoliosis. She went from 22/12 to 13/9. This is a child that got into a car accident. You can see her neck was way out of alignment. Kids respond much quicker. It's easier to correct their misalignments. I noticed her posture is getting better and her leg check got better. So on the third day, we retook the x-ray and you can see it corrected within 3 days. That was really cool. So we really changed her life. And this is about a 12-year-old, and then we took an x-ray from the side of the lower back. He had a complete reversal of the curve like this. So with all the gaming and the phones and stuff we're doing now, we're seeing this a lot more. When I was in chiropractic school 30 years ago, you would never see this in a 12-year-old. It just had never happened. They would have had a tumor here or something. But now with the phones and gaming, we're seeing it all the time. So we're going to have a lot more neurogenic diseases. This one will cause, leg pain, foot pain when somebody gets older. And they went through 12 visits of corrective care, and you can see how he was able to restore that lumbar curve. This is a daughter of a medical doctor up in South Carolina who came down for scoliosis care. And this is her 6-month follow-up x-ray, and she actually was able to go from a 25-degree curve to below 10, so she no longer had scoliosis. This is a patient, I believe he was from Palm Coast. You can see again, he had a 20-degree curve, went down to below 10, no longer had scoliosis, and that was his 9-month follow-up x-ray. So in the office, we go through different corrective procedures to reduce the misalignment. Wobble chair exercises to warm up the spine, cervical repeat traction to bring the head back over the shoulders and the curve of the neck, Eckert table to restore the function of the disc. If it's a scoliosis patient, they're placed in a mirror image of the scoliosis. Cervical vibratory traction helps to restore the function of the disc when we're working on bringing the head back over the shoulders and the curve of the neck. Core stim is helping to balance the muscles. It helps to get lactic acid and toxins out of the muscles. Mechanical drop helps with rib deformation. When you have a misalignment, especially in the ribs, the upper back, it can affect your heart and lungs. So many people will breathe better when they're doing this one. The adjustment, we're mainly using a handheld instrument because we find a lot of people with auto accidents, scoliosis, neck pain, shoulder pain have ligament damage in their neck. And so it's a better way to do the adjustment. Kyphosis, we talked about that fetal curve. So you should have that fetal curve. And so this is helping to restore that. Many scoliosis patients are flat in here. And then the scoliosis traction chair, you're placed in a mirror image of the curve, then the chair vibrates at a frequency to get your brain to want to hold everything together. Most exercise makes scoliosis worse. So if you look at somebody doing a pull-up with scoliosis, you'll see them go like that. If they're doing a sit-up and they have really ripped abs, you'll actually see their belly button go like that. So this is a way to exercise the spine in a gravity-free situation to straighten everything out. And then when they're done, we do spinal weighting. So we'll do this with non-scoliosis patients too. So an example with a neck and shoulder problem is if the head's forward and you put a weight here, initially the head goes forward, but then the body responds and comes back like this. So the technique we do is depending on the righting reflex, the natural corrective reflex in the body, and the weighting helps to encourage that to happen. So the scoliosis patient, when we put the lever arm out here, the person makes a reaction to that, and then that straightens out the spine. Scoli-brace, the future of scoliosis bracing, this is an overcorrective or a supercorrective brace. So normal medical bracing just is like a tube and it holds your spine in position and they're hoping it doesn't get worse. Scoli-brace is putting you in a mirror image of the curve. So if your curve is here, Scoli-brace is going to put you here. And then if you're young, it'll actually help the bones to grow in a better shape and position. In older patients, it helps to prevent progression, and also sometimes it actually reduces the curve in adults. Also, in elderly patients, many times it's a big pain relief. Like they might not be able to cook anymore, wash dishes, garden, do stuff, wash their car, and it really helps them to be able to function at a higher level. So we do a structural scan of the body. It creates a hologram, and then we send that with our posture pictures and x-rays to Australia to create the Scoli-brace. So it Velcros in the front. Most medical scoliosis bracing Velcros in the back, so it's harder to put on. And then there's air holes for ventilation. They can move in the direction of the correction, but not in the direction that makes it worse. And then this is an example of a patient. She was like this. The brace is putting her here. And then out of the brace 4 months later, you can see how much better she looks. And then this is 12 months out of the brace. So she went from 33 to 11 to 6 degrees. So she had a really nice correction in 22 months. Adults benefit from the brace. So when this guy is wearing the brace, he's 25 years old, he goes from 64 degrees to 39 degrees. Now, he's going to always have scoliosis, but the brace helps to prevent progression, make him feel better, and hopefully reduce it. But in children, we're expecting a 30% reduction with it. In adults, as they get older, the brace is more about keeping them in a better posture. So many times when you go forward like this, when you get older, you get into a lot of pain. When that degenerates, it becomes very hard to correct and the person just never gets out of pain. And so these braces are very helpful with that. many people may be getting like a colon study, and all of a sudden the text says, hey, you have scoliosis. And the patient says, no, I don't. Well, the reason is because all of a sudden one of the segments degenerated and created the scoliosis. So they may be having hip pain, leg pain, knee pain, and it's coming from the scoliosis. And then the adult, because usually in adult scoliosis, degenerative, it's usually in the lumbar spine. So it's a lower cut one than the one we looked at earlier. Waiting is dangerous. So we want one of our goals is to prevent surgery. There's always risk in surgery. So there's in the medical research, they will say it's not a question of if the hardware will fail, it's a question of if the patient lives long enough. And I just had a patient tell me about another patient who their hardware is come loose and it's actually coming through their skin. But because they're older, like 80 years old, the doctors don't know what to do. They don't want to operate on it. But you could actually feel the metal coming through her skin.
That's crazy.
Because the metal sometimes breaks, screws come out. You know, if you had this put in when you're, 15 years old, usually that's about the age you get the surgery, 12 to 15 years old. And now you're, older, that's a long time for that hardware to stay in place. Also, people will get into car accidents. That's another thing, the hardware will break. We had one patient that had to have the hardware removed, and they nicked the sac that the spinal cord's in, and she developed chronic migraines from that. And through our care, we were able to get rid of the migraines, and that was a really good case. How do you get a subluxation? Overwhelming stress, trauma, and toxins. So we think about your spine as like a fuse box, right? If you have the hair dryer going, somebody puts the blender on, and then they start the dryer, the breaker goes, right? So think about your spine, these 24 segments, and when something gets overstressed, it goes out of alignment, just like a breaker switch. So it can be overwhelming stress, trauma. When you go to buy a car, they'll give you the facts report, right? And if they've had an accident, the car's not worth as much as if they haven't had the accident, right? So your body's never quite the same once you've been in an accident. So that can cause subluxation. And then toxins. If our liver and kidney is toxified, it will pull the spine out of alignment. There's something called visceral somatic reflexes. When the organ's stressed, it can also pull the spine out of alignment. The original subluxation. So this is a picture taken from a video produced by the Department of Navy, and they're showing a normal birth. They're teaching doctors how to deliver babies. Do you notice anything in this picture?
Pulling his neck.
Pulling the neck. So these little tiny bones, little tiny ligaments, very little muscles. It's very easy for damage to occur. That's considered one of the causes of scoliosis. But it also could cause headaches, neck pain, shoulder pain in adults later on. The way it affects the spinal cord, it could even cause foot pain, right? Now, if the birth is not going well, they may have to use forceps, and that's even going to be more of a pulling on the neck and cause more alignment issues. The cause of all disease is your body's inability to regenerate. Balance equals health. When you're in your balance physically, chemically, and emotionally, you will be healthy. Fourth attitude is only go to the doctor when you're sick, and you better have insurance. Better to go to the doctor when you're healthy, then you won't need insurance. Fifth attitude, it costs money to stay healthy. True, however, it costs a lot more money to be sick. 50% of all bankruptcies are caused by medical bills. Prevention makes more sense. Take care of your incredible body. So the worst case scenario is you're out of work and you have accumulating medical bills, right? So we don't want to use fear as a motivator, but that's a good reason to take care of yourself. So when we give you exercises to do, eating right, correcting your spine, these are all things that are helping to prevent that from happening. In the state of Florida, we have an unusual car insurance law, and if you get into an accident, you have 2 weeks to get to the doctor, or your car insurance will not pay for you to go to the doctor, okay? Now, there's some very unusual symptoms that you can get from injury in a car accident. Nausea, dizziness, difficulty concentrating, jaw trouble, insomnia, ringing in the ears, lightheadedness. We have a patient right now, ringing in the ears. All of a sudden she has ringing in the ears after the accident. Many times it's concentration issues. So let's say somebody gets into a car accident and they just don't feel like they're getting as much done at work. And 2 weeks go by, they're like, I need to get an appointment with a neurologist. They make the appointment, they get in there. Guess what? It's not covered because they didn't get there in the 2 weeks. And the doctor has got to say in the notes that it's an emergency medical condition. We've had a lot of patients have trouble with that. So be aware of all that. 3 phases of chiropractic care. The first phase is relief care. We want you to get feeling better as quickly as possible. That's the most important thing. Second phase is called corrective care. And if you choose to, we're working on correcting the spine as close to normal as we can. That can be from every day to twice a week. And then the third phase is preventative care. We talked about you're not aware whether you're in alignment or not. So 10% of the nerves are controlled, have to do with pain. 90% have to do with all your other bodily functions. So if you're only focused on pain, then things are going to get real bad before you come in. But if you're to focus on your function, leg checks, posture checks, in between that, that's prevention. So that would be weekly or monthly checkups. The neck bone brings the head forward over the shoulders and puts the curve of the neck. So we talked about one of the common causes of neck pain and shoulder pain, forward head like this. So the neck bone allows you to sleep with the head all the way back, putting the curve in the neck. So everything's relaxed in the position that it should be. These are called prism glasses. So you're looking this way, but you're seeing this way. So it helps you to avoid this kind of posture if you're reading, gaming, watching TV in bed, something like that. An ounce of prevention is worth a pound of cure. Benjamin Franklin, this little guy had infantile torticollis. So after he was born, his head was stuck in this position right here. The doctors wanted to come in and cut the neck muscle right here to balance things out. The mother chose to bring him in here. Within a couple of weeks, he was back to normal. You can see he's doing the tummy time now, putting that cervical curve in the neck, and you can see the mom's happy. He got a really good result. Prevention starts early. This patient has had 6 children. She was a patient during all her pregnancies, and all the kids were checked shortly after they were born. And so prevention starts early. Science-based nutrition is a special program we have where we look at your hair, blood, and urine analysis. It tells you any heavy metal toxicity, vitamin deficiencies, and then from that information, we give you a specific recommendation. So we do your vital signs, history, any medications you're on.
Sign me up.
We then come up with areas that you need help with, and the test will show you metal issues, any vitamin or mineral deficiencies, and then we give a specific recommendation of what you need to take to get these things done better. If you're interested, there's some brochures up there, and Carrie can talk to you about it. When you find that we've helped you, if you let other people know, that's how most people find out about it, so we'd appreciate it. Do you have any questions at all?
No, this is very cool. It's the first time I've experienced something like this, so thank you.
Awesome. All right. And thank you very much for tuning in. And this has been Dr. Jay Hartley from Hartley Chiropractic and Scoliosis Center in St. Augustine, Florida. Have a great night.